Hello, I'm Jason Brusky, an RN and patient navigator with KSB Hospital. Thanks for joining me again. Some of you may have seen my presentation on understanding Medicare a few weeks ago. This is a continuation for that. As I mentioned, there's lots of ways to save some money in your Part D plans and looking for Medicare Advantage plans. There's also the ability to shop for a Medicare supplement online. I prefer to use the Medicare.gov site when comparing plans because it's a government site and there's no one influencing you to buy one plan over another. There's lots of commercials on TV to call this 800 number or use Medicare.com, but you're going to reach a broker. So we're at the Medicare.gov, not COM, so we can be at the Medicare site. As it says, right now it's open enrollment period till December 7th. That started on October 15th, so if you want to switch your plan or you're able to sign up at a new time, now is the perfect time. Or if you're brand new to Medicare, you could actually buy a plan that actually takes place this year. I'm going to go first to where there's the supplements and other insurance, and we're going to look at Medigap policies. Basically, we're going to scroll down to find a Medigap policy. And this is done by zip code because the policy you can buy depends on where you live. So we've gone here, and actually they recommend you put in your age. I'm going to just say I'm new to Medicare, and smokers do pay more, so if you are a non-smoker, by all means put that in there to get some savings. And as you look through here, you can see that like Medicare Plan A, which I mentioned does not cover the Part A deductible, does not cover the Part B deductible, does not cover excess charges, does not cover skilled nursing facilities. So if you were to be admitted to the hospital under Part A, it would not cover any of that $1,408 that you'd have to pay for an inpatient hospitalization. It also shows you that plans in the Lee County area range from $78 to $297 a month for a 65-year-old. And then Plan B kind of shows you goes up a little bit from $114 to $314. One thing B has over A is it does cover your Plan A deductible. Medigap C is very popular because it generally covers everything, including your Part B and Part A deductible. This is a grandfathered plan, so if you didn't turn 65 on or before January 1st, you would not be eligible for this. But the premium's a little higher at $133 to $397. D is just like C, except you have to pay the $198 Medicare Part B deductible to start your year. But as you see, the premiums do drop a little bit. F's another grandfathered plan. Once again, you had to be 65 before January 1st, 2020. It can go up to $400 a month, so it can be a very expensive plan. And I did share the high deductible plan as a decent alternative for many people because it has a very low deductible between $33 and $67 a month. You have to pay $2,340 out of your pocket before it starts to kick in at all. But if you're really healthy, you can pay a low premium if you're not using Medicare. And then as you go on, you need to meet this deductible. But if you look at the difference in premiums and do the math, you'll usually pay over $2,340 more in a year to have the Plan F with no deductible. I recommend just put about 2 years worth of deductible in a healthcare savings account, and you can enjoy low-cost savings with a Part F high deductible plan. And Part G for new members that were 65 after the beginning of this year has a very similar option, but you have to pay the Part B deductible in addition to the $2,340. Then there's a few other plans on there, but there's one more I want to show in the area that I think is worth looking at, and that's the Part N plan. As you can see, $81 isn't that bad, but it can go up to $358, so this can be very expensive. You still have to pay the Part B deductible, and it often has co-pays for doctor's appointments, but other than that, it pays very, very well for everything else. So for some people, that's a very good plan to look at. So that is all I'm going to really talk about the supplement plans. As I said, you can compare them by putting your age at the website. We're going to look at pretty much Part D, but we're also going to look into, we can compare Advantage plans here too. Now obviously if you want to just change, you can just click this right now, find 221 healthcare plans. This box is only here during open enrollment, so any other time of the year You could just go directly to Part D coverage. I'm going to scroll down to cost, and it gives you lots of choices to kind of show how it works. Cost if you pay a late enrollment fee, cost if you get extra help. But we want to look for specifically, I want to either change my plan or compare the plans that are out there today. So I'm going to go down here to look for specific Medicare drug plans. Once again, you can log in and create an account. This would allow you to save your med list, which could be pretty useful. I am not of Medicare age, so I do not have an account created, so I'm going to log in without an account. I'm going to just first look at a Medicare Advantage plan and explain those a little bit. So I'm just going to click that that's what I'm looking for. Once again, I'm just going to pick my current zip code. And 61021 does have some Ogle County area, so make sure you do choose the right county. Now, if you knew you got assistance from Medicaid, supplemental security income, Medicare savings programs, or extra help from Social Security, you could check those. If you click I'm not sure, it may ask for your Social Security number so you can put in there. Or if you just want to move in and find out later, you can just put you don't get any help from any of these. Now, a lot of times if you're on medicine, it is good to put in your brand name medicines to really compare plans. I'm going to put in a really common one when I get to it, and I'm also going to compare retail and mail order pharmacy, so I can click both. I recommend clicking both because sometimes you may see that some plans offer dynamite coverage under mail order, but most of them are pretty much just tripling your retail pharmacy cost when you do mail order. I'm going to pick a drug that's pretty popular. It's a blood thinner used to treat DVT, a blood clot in your leg or blood clots in your lungs, are also given for people with AFib to help prevent strokes. And then you just gotta add it. I'm gonna pick the most common dose of 5 milligram, but if you knew you were on 2.5, you can switch the dose right here. Normally it's taken twice a day, so you do get 60 every month. And I'm gonna add one generic just to show you why it's not that important to add generics. And if you had AFib, you might also be on metoprolol, which is a beta blocker to slow down your heart rate. And we'll just put a kind of standard dose for that. So if you have more drugs, you just keep find and add drugs, but we're just put done adding drugs. It puts the pharmacies within 5 miles usually is what comes their standard, but you can expand that. I like to pick a local pharmacy like Felker's, and then I like to pick the big national pharmacies like Walmart and Walgreens, because sometimes your plans have a different cost depending on what pharmacy you use, or some pharmacies are not even in the plan's network. And you could choose up to 5 different pharmacies or 4 retail and 1 mail order. Now it loads them, and this is what I like to do. I like to look at lowest drug and premium cost. What this means is what I'm paying for the premium plus what I'm paying for the actual drugs I listed. It's going to show you, it's going to rank them from cheapest to most expensive for the whole calendar year, meaning this is your total cost per year estimated. And as you can see right here, it shows an Aetna plan that has a monthly premium of $0. You still got to pay the Part B premium that the government put in there. And then it estimates that your yearly drug and premium cost would be $94. I'm just going to add that to compare, because I usually like to compare the top one. You notice these are both Aetna plans. I'm not going to look at all the Aetna plans, because sometimes I like to look at their competitors too. This one, you notice, actually has a monthly premium in addition to the Part B premium of $144.60. So, and they estimate that you're going to pay a little bit more for this one, and I'm going to that one. I want to scroll way down to the end on this and find something you need to look for when you buy an Advantage plan. Sometimes you're not in medicine and you pick the cheapest Advantage plan you can find. There's one. This one only has health coverage. This one does not cover your medications. So if you bought this particular Advantage plan, you still have to buy a Part D plan. Also look that basically you're going to pay about $1,200. That's pretty much what you're paying the pharmacy retail for this, because this plan doesn't help you at all. So I always tell people, you may want to purchase a Advantage plan that has drug coverage, especially since the first one I checked had no premium, also had drug coverage, so you can, for no additional cost, have drug coverage with it. Kind of also shows you a big briefing at A lot of these have vision and dental, which traditional Medicare does not offer. Hearing. This one doesn't help with transportation, but would help with maybe a health club membership. Worldwide emergency, and telehealth, where you could communicate with a healthcare provider via your internet connection on a computer or via telephone. It shows that generally you have a copay when you see your primary doctor and a higher copay when you see a specialist. So now if I just click compare, it's going to start comparing these plans for me. It compares them side by side for starters, and you can compare up to 3 in a row. And it kind of shows you that the plan on the left is $32 a month cheaper. It has a higher out-of-network for total cost than, or in-network, and this one has a, actually this one's cheaper in-network, but when you add out-of-network, it gets a little bit higher. And it looks like the plan on the right does not offer out-of-network coverage. Even shows you that this one has over-the-counter drug benefits where this one does not. The co-pays on this one are actually cheaper than this one if you're in-network. So kind of, if I was advising one of my family members, I don't tend to advise patients which ones to buy. This one looks a lot better than this plan. It even has a higher star rating, so the customers who have had this plan have been happy with it. But we're going to go down and kind of go to the medicines here. It shows you that you can see the pharmacies can make a difference how much your meds cost. Going to Walmart or Felker is actually cheaper than going to Walgreens. And if we want to look at it in greater detail, we just click Plan Detail and it will break it down for us. And when we break down, I'm just going to show you more details about mental health services, therapy services, like you have a copay for occupational therapy. Whereas if you had traditional Medicare with a Medicare supplement, you likely would not have to pay anything for an occupational therapy visit. Skilled nursing services, it has 100% coverage of days 1 through 20 with a skilled nursing facility, which is the same as traditional Medicare. But I will tell you, these people may decide whether you qualify for nursing home coverage or what nursing home you can choose. Where traditional Medicare, as long as you have the 3-day qualifying stay and a skilled need, you are allowed to go to a nursing home of your choice that has an open bed and get your Medicare benefit. So we're going to scroll all the way down to the meds though, because this is something that I recommend when you're looking at your medicines to look at. This one shows preferred generic and generic have a $0 copay, preferred brand name $47 copay, and a non-preferred one $100 copay. It shows you 2 are preferred in-network, 1 standard. And I'm going to skip the standard in-network because it's the more expensive, so we'll just pass through Walgreens because you want to maximize your savings. And we'll keep local since right now in a COVID world, it's nice to support our local businesses. Eliquis shows that they have an agreement of a $481.23 retail cost. Keep in mind this is estimated. Once your deductible is met, if you have one, which this plan does not, it drops to $47. You notice metoprolol is $2.09. It's a very inexpensive medicine. Your cost is a $0 copay, which is why I recommend you don't need to put generic medicines in here. So you're going to pay $47 a month for these 2 medicines, and it showed you if you signed up today, you would pay $47 in November and $47 in December. And that was for a 2020 plan. So if you were new and wanted to buy one today, this plan looks really, really nice. Interestingly enough, though, this plan may not be as good for next year. So we'll quickly compare a 2021 plan. Let's go back to results. And this one warns you there may be a separate drug plan with lower drug costs that you could look about. But here, right at top, it says reviewing 2020 plans. We're going to show 2021 plans. So if you currently have a Medicare Advantage plan and want to switch, this is where you want to be, is looking at 2021 plans, because this will show you if your plan is better than the plan next year. This looks like the same plan we were looking at before. So we're going to go ahead and check that one. You notice that this number got a lot bigger because this is estimating for the whole year It was $94 on the last one slide, but now it's $883 because that's 12 months worth that it's estimating. It's still got a $0 health and $0 drug deductible, very similar in and out of networks as they had last year. And then if you had a current plan and you wanted to compare them, find your plan that you currently have, and let's just say you were an AARP Medicare Advantage and your plan ID was this one. This is on your card somewhere. It's awfully hard to find. I had a woman today I was talking to because her husband didn't bring her card in. We were trying to find his plan, and it took her a while to track down this number on her card. So, but it's the plan ID number. Sometimes it'll say CMS number on some cards. So if we were an AARP customer and we wanted to compare this with this Aetna one, side by side, as you can see, AARP charges us $25 a month for our drug monthly premium, where this one's $0. So if we switch, we already put 25 bucks in our pocket in premium savings. Everything else here looks pretty similar, but this has a much lower out-of-pocket in-network. So if you use healthcare a lot, especially if you think you're going to be in the hospital once or twice a year, even though you might be paying a higher premium, this could substantially save you a lot of money, because 25 times 12 is a lot lower than the difference here of $2,000. They pretty much cover about the same things. This one won't cover meals for short durations or endodontics, periodontics, or extractions. So you have teeth issues. This other plan over here may be a better one for you anyway. Co-pays are very similar, $5 difference. Labs, this is pretty standard. It's $20 co-pay, where this could vary depending on the test and procedure. So these could vary, but they're very compatible plans. But let's look where we're at medicine-wise. Because a lot of people in a lot of medicines, this is often what will make them make a choice. And as you can see, we're looking at $200 to almost $400 difference in savings by switching from the AARP to the Aetna plan. So based on just taking Eliquis alone, if you're fairly healthy and you don't anticipate a lot of hospitalizations, this plan may be really good for you. The last thing to consider, though, is do you have a specialist in a town that only accepts one of these over the other? I met a patient who needed a surgery from a doctor that specialized in a particular shoulder surgery in DeKalb last year, and they only accepted the Aetna plan. So obviously they could not have had an AARP plan and had that doctor provide their surgery at a cost they could afford. From my knowledge, I can't think of any plan in the service area right now that KSB is not honoring and accepting. So if it's a local doctor, you're probably fine to be very competitive using the site, but you may have to make a call to your provider if they're out of the area to make sure they're in network. We're going to go now to the traditional Part D people, and I recommend everyone who has a Part D plan do this every year during open enrollment. So I got to get back to the original Medicare page. All right, so we're just going to continue. Now we're just going to look for a Part D drug plan. You can actually cross-shop and also shop for Medigap Policies at the same time if you'd like to, but we're just going to look for our drug plan. Because usually if you're changing an open enrollment, you already have your supplement already, and if you already have Part D and you have your supplement, you're not looking into the Advantage plans. So we'll just check Part D. I'm going to still say I live in Lee County. And I'm still going to scroll down and mention that I don't get any help from these programs, but if I knew for sure, put them in there. If you get extra help, especially, certain plans are not included and they will exclude them from your search. And I'm going to remove Eliquis now and this one, and we're going to pick on a diabetic now. Levemir is a common long-acting insulin that's pretty popular. If you take a larger dose, you may have to increase the amount of pins you get, but we're going to just put our doses low enough that we can get by on 3 milliliter pins sold in a pack of 5. And I'm going to just keep the same 5 pharmacies I usually pick. If you lived in Sterling or Rock Falls, you may want to add CVS, and of course you would pick a different area, zip code when you chose your plans. And I'm also going to include mail order to make sure that doesn't make a big difference. And once again, I got the lowest drug and premium cost. If you were not on any medicine, you may want to do the lowest monthly premium. Obviously, this WellCare Wellness plan only costs $13.20 a month. If you're on no medicine, why do you need one of these plans? Well, if you're eligible for Medicare and you do not have qualified medication coverage and you elect to skip signing up for Part D, the minute you decide to sign up for it, you have to pay a penalty premium, which is based on a certain percentage of a number the government sets, which will be about $35 next year. And it's for every month you didn't have coverage, you have to pay a certain percentage of that 34 added onto your premium. So I recommend if you're on no meds, go to the lowest monthly premium, and then when you start having meds, look to change during open enrollment. Yearly drug deductible, I'm not a big fan of this because some of the plans with no deductibles have such a high premium that you're going to pay a lot more per year to just get away from a drug deductible. So once again, lowest drug and premium costs, because this will show me pretty much what this is going to cost me on this medicine per year. And you notice that really cheap $13.20 plan for Levemir users is not the least expensive plan for you. The Cigna HealthSpring actually has been the one that keeps popping up when I've been having patients looking already. They've been noticing that. And once again, I'm viewing plans for this year, so I'm going to jump to next year. And this WellCare plan, looks really good right now. I love to compare the cheapest plan on top. This one, nice part, it's got star ratings. But as I scroll down, I usually might look for, this plan's really new, so it's too new to be measured, but sometimes the cheapest plans out there are. 2 years ago, this plan was really good. It was really inexpensive, which right now, it's only $7.30, which is a cheaper premium, but it has a $445 drug deductible. So you have to pay about $445 to start the year before it starts to cover your Levemir. Where this plan only has a $100 drug deductible, so sometimes that's the difference. If you're on a lot of brand name drugs, often the higher deductible plans are better. But I'm going to throw in this plan with a $0 drug deductible, but you already noticed the premium is $77.10. So I looked at 3 plans. The first 2 do have a deductible, and this one does not. This one anticipates that I'm going to pay for my prescription about $600. This one for the same medicine is going to be twice that. So if I want to be on Levemir, obviously these last 2 plans are not for me. Going to look at the, here it shows that once again they have agreement for a retail cost. And then cost before deductibles, $35, and after deductibles, $35. And what's really interesting is Levemir in this particular plan does not apply to deductible. And the reason is, in this plan, Levemir is way at the bottom, a tier 3, but one thing our government was really concerned about the price of insulin this year, that some of the, one of the executive orders that was written to help with insulin costs has made a difference that all of a sudden a lot of plans are not applying insulin to the deductible. So if you purchase this plan for $14.70 a month on Levemir in January, you would pay $35 for your prescription. And all the way through the year, you would pay $35. You would not even meet the donut hole with this plan, which that is unheard of every time I've been comparing Levemir or other insulins. Every other calendar year, you expected to pay about $400 to $450 the first month, then a copay between $30 to $47, and then you'd get this coverage gap that would turn into about $130. But based on some things that were passed this year, it's much cheaper. So if you have any questions, we'll have some information after this program for you to be able to submit some questions that I can get back to you on at a later date. Thank you so much for watching this.